Ann-Marie Alameddin, the new, as of the last 2 months, CEO of the Arizona Hospital and Healthcare Association. Let's give her a round of applause. Welcome. I appreciate you being here. Yeah. Let me ask you sort of a similar question about focus and attention, because there's plenty to distract us. What do you feel like, what are you spending your mental energy on these days at AzHHA?
I think certainly for this week it's been the budget negotiation and what's in the budget and what's out. And just trying to articulate for what was out. We understood GME was not going to be included, and just to articulate the importance of addressing the physician shortage in Arizona and really supporting that package. And then, celebrating some of the wins that we hope with kids care and having working poor families have access to affordable health care coverage for their children. So that's kind of in the short term. We had, just the budget to really focus on what was really important right now and to make sure that our healthcare priorities were making it through the finish line. Yeah.
We talked at some length last night, and you said something that was insightful that I think maybe we all sort of maybe think, I don't know, but we sort of, I don't know, maybe we don't, but you said, value-based care, you can't be successful in value-based care without values, or something like that, and meaning sort of a moral center to the work that we're doing in healthcare. Maybe explain what you meant by that.
Absolutely. So, what all of us do in this room, however we're engaged in healthcare, we all know that it's incredibly important because it's healthcare. It's where we all access services. And it's not this objective, entity that we tinker at from afar. We're all a part of it at our most vulnerable times in our lives. And so what are we doing in healthcare to make sure that we are keeping patients and people at the center of that universe? And that is ultimately what it's about. And if we can all sort of put that flag in the sand, then we all can kind of align around that. And that's really important. And that's what we do at the Arizona Hospital and Healthcare Association. Our hospital members align with what are in the best interest of the patients. How can we create a healthcare system that honors the patients and what's important to them? Because it is, as we all know, it is so overwhelming and complicated. But you can kind of see through the fog a bit if you keep those values, patient-centered values and person-centered values, because it's about providers too, and really honoring. And the last session I was just in, listening about that connection between provider and patient. And providers are under a tremendous amount of stress too. So how do we change that healthcare system to honor that connection? I think that's what the panelists described in the last session. How do we honor that connection? That's really important, and we've got to move that in the right direction. And I think it takes all of us in the room and beyond this room and the community to do that. But we need to have that sort of principled approach to how we advance healthcare.
Why is it that when I go into the hospital, I always feel like it's like I can't wait to get out of there? Whether it's in there with my wife as we're having children and she's having kids and I'm watching, or my parents getting sick, it just feels like the pressure and the complexity, and we have lost some of that person-centeredness. I can see it with my primary care doc, whether he or she, maybe that's a great relationship, maybe it's not, but I at least can see the person-centeredness. In the hospital setting, I just feel like I'm in the belly of the beast. What do you think about any of that? Am I off base? Am I sort of throwing hospitals under the bus? I mean, what do you make of that sort of sense that it's just not a great place I want to be?
I think hospitals are working hard to change that, to make patients, so that patients feel engaged and empowered, and that, they work really hard through like patient-family engagement. But it's hard work because of the pressures and the burdens within the healthcare system, whether it be regulatory-wise or otherwise. But I think it's all a learning perspective too, because I would imagine many of us in the room have been in the hospital, not in a professional way, right? Personally, with your own family member or for yourself. And I don't know about you, but whenever I enter that healthcare system, my eyes are opened to that complexity and how much work we have to do. And there is a lot of work to do, but it's up to us to do it.
Yeah.
And to improve it and to make it more patient-centered. So I agree, there is a lot of work to do, but hospitals are working hard and clinicians are working hard to change that and to do that. And I think we have to structurally, as a system, do what we can to sort of free that up as well. Mm-hmm. But my mom is late 80s, really complicated patient in the hospital, a couple different visits. And it's such a window to, wow, and a really wonderful hospital. Mm-hmm. But it's always a window to, there is more to do. I think that's how a lot of our our quality work in hospitals started, was, CEOs of hospitals had an experience in their own hospital and said, oh, there's opportunity here to change this and to improve this for all of us, because it's ours. We will all be there.
Yeah. So tying together some of these threads, on the one hand, there's a lot going on in the policy world that you're spending your mental energy on. There's only so many things we can focus on because of all of the distractions in our world. When we have you back for our 2029 Arizona State of Reform Health Policy Conference in 10 years, and you say, you know what, the thing I am most proud of having done in the last 10 years, what will you say when I ask you that question 10 years from now? Under your leadership, what will be the thing that you'll be most proud of having done at the Hospital Association? She knew this was coming, by the way. It's not just a hard question, but it's a hard question, and she knew it was coming.
Well, one of our initiatives at the Arizona Hospital Association is our Thoughtful Life Conversations, and that's our end-of-life care initiative that we need to, and this is our member hospitals coming in our boardroom saying, what are the burning issues we need to address? And they said, end-of-life care. We see patients in our ICUs with stage 4 cancer, and they haven't yet had that conversation with their family and with their providers of what kind of care does the patient want at the end of their life. And have they expressed that in the legal documents necessary? Have they talked to their family members? And there's a lot of work to do in this area in the country, and particularly in Arizona. So if we can improve end-of-life care in Arizona, and if we can lead that work, and we are, in educating providers and educating the community, that really makes a difference. Yeah. To empower patients to express how they want to spend the rest of their days. And that we have a system to support that. And then you can do that through various policy mechanisms that we're working on, right now at the state. But if we could do that the next 10 years, I would happily sort of retire, that we could be a part of leading that. That would be incredibly meaningful. And that's the work we should be doing.
Yeah. So you're filling some big shoes. Greg Victor is now, I guess the title is CEO Emeritus.
Yes, sir.
He has been down here about 8 years or 9 years or so. Mm-hmm. What is Greg like as a CEO? What will you have learned from him, watching him and his leadership?
Yeah, Greg is here in this room, so it's wonderful that he could attend this as well. But he was a real servant leader in his role. And he really brought or helped our members articulate that value that they had in their hospital in terms of patient-centered care. the value of improving health and health care for the people, patients, and communities of Arizona, and that's not a tagline. That's work we actually do with our programs and with our policy. That is the value that anchors our work. So that is incredibly, that's sort of that philosophical framework that guides us. And that is what we've learned from him. I think that's his legacy, and he certainly helped frame that and had really robust discussions in our boardroom where each of the CEOs could sort of bring the values of their organizations to the values of our public policy priorities. So it is definitely large shoes to fill, and he's been incredibly gracious in the transition. So that's probably a good segue if we could, perhaps at some point he could stand up and be recognized. So Greg Vigdor, I know he's like glaring, hi there. So, yeah.
So as of course Greg knows, because he was brought in as a result of this complexity, the hospital politics in Arizona are complex and complicated. Give us a sort of 101 explanation of where the hospital politics sit today. What does the future look like in terms of the hospitals coming together with one voice to help drive system reform forward?
Yeah, as most people know in this room, the hospital industry is fractured in terms of associations. And I think if we can elevate the conversation to more of a values approach, what are the values of AzHHA? What are the values of the Alliance? And what's common there? I think there's probably more that unites us than divides us. And then at that point, it's unifying on tactics. So how do you build that bridge? How do you find the initiatives that there's joint interest in? I think GME is a really good example. The industry was united on that. And when we're united, we're stronger. And that's stronger not just for an industry, for the communities we serve. So there's more work to be done there. There's a lot of work to do, period, right?
Yeah.
But it's about relationships, and it's about building those bridges and finding areas of common interests. And I think they're there.
How do we argue, and I ask this because I think hospitals, and particularly the hospitals, the association or associations, are really a sine qua non group. Without the hospitals on board, it's very hard to make something successful, either in the marketplace or in the policy world. And we're at this place because of this frustration over cost and quality and that feeling you get sometimes in the belly of the beast, where there's this building political backlash, where the simple answer may be wrong, but it just feels good. And so let's repeal and replace, or let's have single payer, or whatever it is. And so the sort of hard slog of doing the work is just not very sexy ever, but particularly right now. What do you think that means for the future? How does the hospital association, or how do leaders in this room argue for just doing the unsexy hard work that makes this system improve? How do we do that when there's this sort of political backlash building that wants to wipe it all out, to quote Kamala Harris?
I think we dig in. This is what we did during repeal and replace. We would model the different the different bills, and to see what those impacts were on the hospitals. And then it's going through the bills to see what those impacts are, and then giving that information to the hospitals, and then engaging with legislators, with our congressmen, and educating them in terms of what was the impact of repeal and replace? What does that really look like in Arizona? That isn't just a slogan. It really means jobs. It means funding. It means access to healthcare services. It means people will lose healthcare coverage who have cancer. And it's painting that realistic picture of taking it from a slogan to actual implementation, so that our elected officials are aware of what's at stake. And we had significant conversations with Senator McCain's office during that time. And it was really looking at those Arizona impacts of taking the theoretical to the practical. so that you could sort of strip away the political ideology, which I think we have to do, because Medicare for All and other, it's really it's a slogan right now. But what does that mean? What does that look like? And how can we understand it? I mean, that's the work of hospital associations and policy wonks, is to really dig deep, understand it, and then articulate and communicate what that means both for our elected officials and for our community. And I think that's something we have to work hard on as a healthcare community, is translation, because what does it really mean? And we can get very jargony, and everybody knows healthcare is complex, and then I think sometimes people check out. Oh, I'm not in healthcare, I don't understand it. Well, we need to, as an industry, articulate that and make that case of why it matters to every person to be engaged.
So last question, how can this group of folks, this audience of senior leaders, how can they help you do what you do and support you in your capacity?
Well, I mean, I think it's what many of them do with us already. It's come to events like this, come to the table, as I mean, part of what we do at the Arizona Hospital Association is we see ourselves as a platform to solve problems. They might be raised by our hospital members, but we know it has implications beyond the hospital walls. So we invite health plans to the table, and community partners and public health, and we dig deep and we figure it out. But it takes that collaboration. None of us can do it in a silo. That's why something like this conference is so important, because it's the dialogue across all the different sectors to figure out what that path forward is.
Well,
so thanks for being a part of the process.
Yeah, Ann-Marie Alameddin, thank you very much for your time being here. Let's give her a round of applause.